Hello, everyone. Very happy to be here. My name is Dr. James Furr. I'm a urologist at the University of Oklahoma. I specialize in male reconstruction and men's health. So a lot of what I deal with is things that men have to go through after having their prostate cancer treated, such as incontinence and erectile dysfunction, which is what the talk will be focused on today. As you all know, I'm here speaking to you today as part of the ZERO Prostate Cancer Summit 2023. And just a quick acknowledgement of our sponsors, Boston Scientific, who do a lot in this space. Now, like I said, a lot of what I do involves helping men who have had prostate cancer and prostate cancer treatment getting back to some semblance of normal. And really what happens is this falls into one of two categories. One is bladder control, or what we call incontinence, and the other is sexual health, namely erectile dysfunction. So we'll start with what we call restoring your continence or regaining bladder control after prostate cancer treatment. Now, usually after prostate cancer treatment, it isn't really all that uncommon for men to experience a little bit of leakage, like maybe a few drops of urine, or maybe a complete uncontrolled stream for a period of time afterwards. And a lot of that has to do with kind of the precarious location of where the prostate is. If you look to the right there, you can see that the prostate is located just under the bladder, and the urethra goes through the prostate into the penile tissues and out into the world. Right by the prostate is this muscle group called the sphincter, and that's essentially a muscle that our body uses to control when urine comes in and out. And through various prostate cancer treatments, that sphincter can be either damaged or shocked, and it might take a little while for it to recover. Most of the time, this leakage will taper off within a few weeks or months at most. And the vast majority of patients, we're talking 90 to 95% of patients, especially with new technologies, will regain their bladder control within about a year. However, as you might imagine, if this persists and if it's very severe, constant leakage can certainly affect your day-to-day life and your quality of life. In one more recent study, we found that even though most men recover completely, there's still about 1 in 10 men that will have persistent stress urinary incontinence about a year after robotic prostatectomy. Now, that's the approach in which the prostate is removed for prostate cancer. However, fortunately, if this is something that is very severe or it bothers you, there are a multitude of options that we have to help. If the leakage is really mild, some men might choose to just do some non-invasive interventions. These might include absorbent pads or maybe adult diapers. There are these things called catheter collection devices, which is essentially just a condom that collects the urine as it drips out of the penis and drains into a bag. There's something called a Cunningham clamp or a penile clamp that you can see there that prevents the urine from coming out. And some doctors will even send you to a pelvic floor specialist or a physical therapist who will help you strengthen the muscles that may have been shocked or damaged in order to gain continence back. However, if those interventions aren't enough, or maybe it's been over a year and you're still having 2 to 3 to 4, maybe even more than that pad per day leakage, there are a couple different, little bit more invasive interventions that we can engage in. One is called an injection of a bulking agent, and that's when your doctor will look through your urethra with a camera and inject essentially this kind of filler type material to bulk up the urethral tissues and to increase the resistance. However, unfortunately, some of the data shows that this isn't that durable of an intervention. So many of these men will move on to something called a male sling, and that's kind of seen in the diagram over there to the right. Essentially, the way I explain it to my patients is that this is more or less kind of a hammock that we surgically implant around the urethra that is intended to support the urethra and increase the resistance in that area, so that when your when you're laughing or sneezing or coughing or maybe lifting something heavy, that extra support prevents you from having any leakage. If your doctor thinks that you're a good candidate for this procedure and it is successful, most patients will be continent almost immediately after the procedure. However, in some men, none of these things that we talked about is enough. Maybe they have very severe leakage. They're leaking 6, 7, 8 pads a day, or they're in diapers, or maybe they've had a sling placed previously and it didn't work very well. Then we move on to what is our gold standard of care, which is what's called an artificial urinary sphincter. And you can see the diagram there to the right. This is a device made by Boston Scientific. It's made up of 3 components. The most critical component is the cuff that we surgically wrap around the urethra. And then that cuff is controlled by the patient through a control pump that sits in the scrotum by the testicles. And then there is what's called a pressure regulating balloon that kind of manages the pressures within the system that sit back behind the bladder or underneath your abdominal muscles. And what this is supposed to do is it's supposed to mimic the function of a healthy urinary sphincter, that muscle group that we were talking about earlier, so that when a man wants to urinate, he will deflate the cuff using the control pump, urinate normally, and then over the course of the next 60 to 90 seconds, that cuff will reinflate on its own to kind of close off the urethra, preventing any further leakage so you can go about your day. So this has been proven to be a very successful device for men with severe incontinence. Now, whichever one of these interventions we end up doing is going to come down to kind of a shared decision-making and a conversation with you and your doctor. And so there's a multitude of tools that we have available to us that can determine how bad your leakage is, because a lot of the times how bad your leakage is really going to dictate what your doctor suggests they do for you in some instances. So if you look here, there's a website called fixincontinence.com. There's a bladder leakage quiz there that can really determine how bad you're leaking. And some men just use a regular old journal to chart how many pads they're going through a day over the course of a day or a week or a month or whatever it might be. And with that information, you and your doctor will end up coming up with the best interventions for each individual patient. Now, the second thing that I was going to talk to you about is restoring your sexual health after prostate cancer treatment. And what really that boils down to most of the time is erectile dysfunction. And unfortunately, we find this to be a little bit more common than the leakage problems after prostate cancer treatment. The reason is that any kind of prostate cancer treatment affects the nerves that wrap or that go to the penile tissues and control erections. Those nerves run right alongside the prostate. So a lot of times it's very hard not to affect those nerves with any kind of treatment. In some instances, this might take as long as 2 years or so to recover complete sexual function. And in about 30 to 50% of men, depending on which study you read, their normal erectile function may not come back all the way. Some doctors might talk to you about penile rehabilitation after your prostate surgery. And the goal of that is to really get you on a program to help those nerves regenerate and help those nerves recover faster after your prostate cancer treatment. However, if you have gone through all this time and have tried a multitude of things and your erections aren't the way they were, aren't how they were after surgery, the way they were before surgery, there are a multitude of options that we can help regain normal sexual relationship. Here's kind of a list of more of the non-invasive interventions that we do for your run-of-the-mill male with erectile dysfunction. They may or may not have even had any kind of prostate cancer treatment. We know that erectile dysfunction is common in all men, but it is somewhat worse in men who have had prostate cancer treatment previously. The kind of the gold standard that people start with are oral medications. So most men have heard of these medications. They might include Viagra or Cialis. We see plenty of commercials on TV marketing these things. And a lot of times they might be offered to you before or in preparation for your prostate cancer treatment. And then they can be continued afterwards if we're seeing a good effect. Other things might include a vacuum pump that essentially pulls blood into the penile tissues that can be used as both a part of a rehab program or to help you gain erections back in general. And then there's a little bit more invasive ways that we deliver medications. The most common one is the penile injections, where your doctor might bring you into the clinic and teach you how to inject yourself with a highly concentrated version of a medication that works on the penile tissues to give you an erection. And then there's there's probably a less common medication that some people will prescribe called a urethral suppository, in which the medication is delivered through the tip of the penis or the urethra. And so those kind of are the full spectrum of things that are non-invasive. But if we want to start talking about the more definitive things, then we start talking about more of the procedures, which include the penile implant. And the penile implant is the schematic drawing is seen over there on the right. But essentially, this is an inflatable device that's used as a pump, and it's placed in the scrotum that you can use to inflate and deflate before sexual intercourse. So on the right, you see the two cylinders there within the penile tissues. And then similar to the sphincter device, you see a control pump in the scrotum and then a reservoir bag that sits behind the bladder or underneath the stomach muscles. And the goal is that whenever you do want to have intercourse, you use that control pump to bring fluid into the cylinders to cause an erection. And then when you're finished, you turn it off and the fluid goes back into the reservoir space. The most common things we talk about afterwards, the most common questions is does it feel natural? And the vast majority of patients will say that it feels natural during intercourse, both for them and their partners. One of the biggest positives is that it does offer a little bit more spontaneity than the other interventions, in that you can just use it whenever you want. You don't have to run to the fridge to get any medication or run to the medicine cabinet to get any pills. It's completely concealed. Nobody's going to know that you have one, unless they're, a close partner. And another thing is that it maintains an erection for as long as you want. So those are the things that are certainly positives about the device. I think that it's important to understand where you are in this journey, because not everybody is at the same place and not everybody is ready for certain types of interventions. They might still be recovering. They might need other things to get their cancer under a little bit better control. So understanding where you are in this journey is important. And there's a multitude of resources that these websites have available for you. edcure.org is a really good resource that I send a lot of my patients, where they can go on there and determine with various quizzes the full extent of their erectile dysfunction and determine whether or not they're ready to move on to the next step. So a lot of common questions we get in the office about a lot of these interventions. The first one here is, how long does it take to achieve bladder control? And to kind of piggyback on what we were talking about recently, I would like to reinforce that the vast majority of men will completely get their bladder control back at about 6 months to a year at most. And that's thanks to a lot of the new technologies our cancer doctors have brought into the field to minimize this potential side effect. However, even with these new technologies, we still see about 1 in 10 men with persistent urinary incontinence. Another question I get is why don't all men recover their erectile dysfunction after treatment? And that kind of coincides with what I was discussing earlier on the anatomy of the nerves that control the penile tissues. They run right by the prostate, and sometimes it's very difficult to get you good cancer control and get the cancer out in its entirety without affecting those nerves. And more often, a lot of men who get prostate cancer are in their late 50s, 60s, or even 70s, and they might have other pre-existing conditions like cardiovascular disease, diabetes, maybe they were a smoker, which in and of themselves can cause problems with erectile function. And then they go and add prostate cancer treatment on top of that, and it kind of compounds the problem. And then probably the most common question I get is the insurance question regarding the penile implants. And by and large, most private insurance companies are very good about covering the penile implant, and Medicare is as well. And a lot of times these companies will cover the penile implant a little bit better than some of the medications that we have in the field. So that typically isn't a big barrier to us getting the appropriate care to the appropriate patients. You know, I won't belabor the point too much. These are some patient testimonials regarding things like the male sling and the penile implant and the AUS surgery. And I'll just, you know, let the population read these slides about what they say, but I will kind of say that this mimics a lot of the same sentiments that I get from my patients in clinic who have undergone these interventions. As long as we are clear about expectations and understand what our goals are and pick the appropriate intervention for the appropriate patient, I feel that by and large, most men are very, very happy with these types of interventions that we do for incontinence and erectile dysfunction. So here's a couple of the resources that we have available to people who need more information on these two topics. We see fixincontinence.com and edcure.org, and then some general prostate cancer resources as well that are excellent resources to educate yourselves. So in conclusion, we really talked about two big things today: urinary control. Like I said, most men regain their urinary control in completion, but even if they don't, we have certain interventions that can restore your urinary control and continence. And erectile dysfunction is a little bit more of a common problem, but if the pills don't work, if shots don't work, if other things aren't getting you the results, then we do have the gold standard penile implant that is a very successful option for men who are ready for it. So I tell all my patients, you know, this is a big decision that you have to make, not only for yourself, but for potentially your partner. So it is very helpful to involve your partners in these decision-making discussions. And a lot of times I tell them it's helpful to bring the partner to the appointment so that they are aware of the expectations and options as well. And through shared decision-making discussions with your doctor about these solutions and being honest with your doctor, then you can come up with the best possible solution for where you're at in this journey. Here are some references. And again, I'd like to thank everybody for having me today, and I'm happy to answer questions.